Good day, everyone. We are Group 3B from University of St. LaSalle College of Nursing, BSN 3B. And today we will be presenting our overall research poster for our study we conducted on uncovering emotional resilience, nursing students' experience during clinical psychiatric exposure. I am Labyrinth Rata, and together with me are my group members, Javie, Bryant, Redil, Jun Rovick Regalado, Josephine Rose Rojo, and Danielle Rumbines.
So the research aim for this study is that to deepen the understanding of emotional resilience in psychiatric nursing and implement a referral system to the guidance office for counseling to foster emotional resilience among these students and enhance overall well-being within the healthcare environment.
Moving on to our research design. The chosen research design for this investigation was qualitative research design, firmly rooted in phenomenological research approaches. For our study sample, purposive sampling was the sampling method utilized. One student who scored the highest in the BRS from each of the 7 fourth-year sections of the College of Nursing will fit the criteria chosen to participate in the research, ensuring that they were all able to appropriately comply with the interview and offer necessary data for the study. The criteria that follows must be met by all chosen participants. A. Currently enrolled fourth-year nursing students for the academic year 2023 to 2024. B. Have completed psychiatric nursing exposure during their third-year academic year 2023 to 2024. C. Have had psychiatric nursing exposure at Negros Occidental Drug Rehabilitation Foundation. And D. Students who scored a 4.31 or higher in the brief resilience scale. Moving on to our instruments. Before the interview was conducted, all fourth-year nursing students from one of the nursing schools in Bacolod City underwent a screening process using brief resilience scale to determine each individual's emotional resilience. The brief resilience scale was a psychological tool designed to assess an individual's ability to bounce back from stress and adversity. The instrument was a researcher-made interview guide that consisted of open-ended questions to encourage participants to share their personal narratives and reflect on their experiences. The content was divided into 3 sections. Section A, the demographic profile of the participants. Section B, one central question addressing emotional resilience and psychiatric clinical exposure. And Section C, follow-up question addressing emotional resilience and psychiatric clinical exposure, which consisted of 3 to 4 probing questions.
Let us now continue on to the results. The study was able to identify 5 themes according to the responses of the 7 participants that were interviewed. Theme 1, nursing students' insights into their encounters during clinical psychiatric exposure. This theme aims to highlight the challenges and conveniences of the student nurses during their clinical exposure. The 2 sub-themes identified under this category are 1A, beneficial insights derived from the psychiatric clinical exposure, and 1B, encountered issues and constraints in psychiatric clinical exposure. The second theme is preparations for psychiatric clinical exposure. This theme aims to highlight the different preparations made by nursing students for their exposure. The 4 sub-themes identified under this category are 2A, practicing therapeutic communications towards psychiatric patients, 2B, valuable guidance from the clinical instructors, 2C, strengthening self-awareness and self-preparedness, and 2D, coping after exposure.
The last theme is called Essential Learnings from the Psychiatric Clinical Exposure. 2 sub-themes were also identified. Sub-theme 5A, Perception towards Psychiatric Patients, and Sub-theme 5B, Importance of Mental Health.
In summary, delving into the emotional resilience of nursing students during clinical psychiatric exposure revealed a diverse array of challenges and coping strategies. Through this study, it became evident that navigating the complexities of psychiatric settings fostered both personal and professional growth, despite the emotional toll it may exact. Looking ahead, a collaborative endeavor involving educators, practitioners, and policymakers is essential to safeguard the welfare and readiness of upcoming nursing professionals in the field of psychiatric care. This study also revealed that working in psychiatric settings can be tough for nursing students, but it also helped them grow professionally and personally. It emphasizes the importance of support system and tailored interventions to help students handle the challenges and develop resilience.
That concludes our presentation on our final study on uncovering emotional resilience, nursing students' experience during clinical psychiatric exposure. Thank you.